Hi, I'm Dr. Miner. Today I'm here with a patient and we are going to address her lips. We're going to use some dermal filler for that. And tell us how you'd like those to look.
Better than they look now. That would be the goal.
Okay. Tell us, what does that mean to you? What is better to you?
I want the top lip to be a little more plump. To me, it's a little thin, like especially out this way. And then my lower lip, I'd like it to be a little fuller as well. And then the lines, if we could address any of those in any way, that would be great.
Okay. So with what she wants to accomplish, we're going to use a couple different techniques. So on the lower lip, we're going to basically kind of volumize and give a little bit more pillows, what they call pillows, kind of a little nice little shape to them. And then with the upper lip, we want to show more lip. And so we're going to work to kind of flare out that upper lip so more of that upper lip shows and get a great result. So one of the first things we're going to do as we begin is we're going to apply some topical anesthetic on her lips. And we've done her lips before, and what did you think of that topical?
It was by far the best topical that I've ever had put on my face for pain, for any type of thing. I felt nothing, literally nothing. And when it was over, I thought the pain would come. There was still no pain. So it's the best stuff you can get.
Okay, so this is a topical that we have compounded by a pharmacy, and it works really good as she has conveyed, and we'll get going on that. Alright, so we got done, and we used a product called Revenus Versa, which that's a really nice product for the lips. We don't get a lot of swelling for the lips, so kind of how this looks is, for the most part, how it's going to stay. Whereas with some other fillers, the lips are going to puff up, and then they go down from the swelling. And Versa tends to last several months, probably 6, 9 months, somewhere in there, maybe longer. We see everybody's different. Alright, so she gave me a little bit of an artistic license to kind of do what I think with her lips. And what do you think? How did they turn out?
I think they look amazing. They look clearly so much better than when I came in. I think it looks really good. I'm glad that I have you to do that because I can't. So it's nice to have someone who can look at you and say, this is what you need to do. You're done. And it is. I think I look great.
Great. Thanks. So a couple things to be aware of afterwards is that when the filler is in there at first, it feels kind of rubbery. Do you notice that? A little rubbery feel?
If I lick my lips, I can, it feels different, yeah.
Yeah, and that will go away. It takes a couple weeks. That's just the material needs to soak up some water, and it'll soften and it'll feel pretty much like normal. Again, it will maintain this look. And also with doing some filler, what can happen is the lips get chappy. They'll kind of peel, so it's good to keep some chapstick or lip gloss on them, keep them moist and hydrated. So it's been about 4 weeks now since we did this, and did it feel kind of rubbery at first, or how did it feel?
A little bit. It just felt different. It didn't feel like just your normal lip, but that went away in maybe something like 3 to 5 days or something like that, and then they just felt like my regular lips. But even when they felt different, it didn't feel odd.
Okay.
You know what I mean?
Yep.
It wasn't like, oh my gosh, what's going on? Nothing like that.
Okay. And what do you think of how they look now?
Amazing.
Okay.
I can't believe that by what you did took years off my face. I would have never thought that that could happen. But all of my friends want to know what I did. I of course am lying, saying nothing. Just had my teeth cleaned. That's it. So yeah,
Okay.
I really, really.
Well, what
like
would their
it.
friends say?
Well, they just keep thinking that I've done something to my face. Like,
Okay.
did you have a facelift? Did you have facials? Did you have? They just keep naming things, and I'm like, nope, nope.
But they couldn't tell it was the lips.
Nope.
Okay,
They just
that's
knew
great.
something was different.
Yeah.
They didn't notice whatever it was. It wasn't drastic enough to where they went, "Oh my gosh, you look like Goldie Hawn in First Wife," like, something
Yeah.
like that. No.
Yeah.
Mm-mm.
All
They
right.
still haven't. They still don't know what it is.
Great. And what does your husband think?
He really likes it. He, again, didn't think it was necessary. He thought I was being silly. And then after he saw the results, he was like, you should keep that up whenever it's time to do it again. So,
Okay.
yeah, he really likes it. It does make me look different.
Yeah.
Just younger, which is good when you're my age. Younger
Yeah.
is a good thing.
All right. Great. Thanks.